Good afternoon. We're going to call to order this hearing of the Assembly Committee on Health. And just want to remind folks that our usual rules apply with regard to two witnesses to a side, a time limit of 3 minutes each. We have two items proposed for consent. Those are SB 221, Ms. Walters' bill, and SB 743, a bill of the Senate Committee on Health. And that's it. And we have Senator Wiggins here to present. Welcome, Senator. We're going to call item number 1, SB 158.
Members, I'm taking authors' amendments which are technical in nature to clarify the plans that would be exempt from this bill, pursuant to comment number 8 in the committee's analysis. SB 158 is sponsored by the American College of Obstetricians and Gynecologists and requires health insurance plans to provide coverage for the human papillomavirus vaccine, commonly known as the HPV vaccine, for all young girls and women ages 11 to 26, upon referral of their doctor. HPV has been identified as the primary cause of cervical cancer. According to the Health Benefits Review Report, an estimated 99.5% of current enrollees have coverage for the HPV vaccine, and SB 158 seeks to close this minimal gap. Most importantly, SB 158 will assist in providing preventative health care to prohibit cervical cancer and limit high long-term health care costs. Recent amendments to the bill simply added physician assistants to the list of health care providers who are authorized to make referral for the HPV vaccination. And I have here today Shannon Smith Crowley to testify in support of the bill and to answer any questions the committee may have.
Thank you. Good afternoon, committee. We are the sponsors of SB 158, the American College of Obstetricians and Gynecologists. SB 158 seeks to close a very minimal gap in coverage. Closing this gap is very important to those women that are not covered, because should a woman go in for an HPV vaccine and find out that she's not covered, she may end up getting that vaccination delayed for months, if not years. It's a very expensive vaccine for out-of-pocket cost to the particular woman. And we're talking about the women that are not covered right now are the 19 to 26-year-olds who may not have a whole lot of cash. They may still be on their parents' policy and may not be able to switch policies for quite some time. But one of the other things I wanted for you to keep in mind about this is it's not just cervical cancer that's at issue. Actually, in this country, compared to internationally, we have a lower cervical death rate. But what is really important for many women is that the HPV virus causes significant abnormal cervical changes before cancer develops. There are a lot of procedures that can be done, a lot of cost. National Institute of Health estimates $4 billion a year is spent on cervical cancer changes in abnormal cells. So it's cost savings. It will preserve the integrity of a woman's cervix, which will help with pregnancy. And we ask for your support.
Thank you very much. We're going to take a break in the action to establish a quorum. Ask the Secretary to call the roll.
Jones.
Here.
Fletcher.
Here.
Adams. Amiano. Block. Carter. Conway. De La Torre. De Leon. Emerson. Gaines. Hall. Hayashi. Hernandez. Lowenthal. Nava. Perez. Salas. Strickland.
I believe Mr. Amiano moved, and was there a second on the bill? Ms. Carter seconded the bill. Are there any questions from members of the committee? Yes.
What are the costs associated with implementing this bill?
There's no cost associated with this bill. Actually, I should look at Fiscal effect, according to the Senate Appropriations Committee, pursuant to Senate Rule, is negligible state costs.
Have we heard yet from the opposition to the bill?
No, and we can do that right now if you'd like.
If we could.
So why don't we invite, are there any other witnesses who'd like to speak on behalf of the bill? You would? Yes.
Alma Hernandez with the California Medical Association in support.
Wonderful. Okay, why don't we, any other witnesses in support?
Chris Rosa, representing the Medical Oncology of Southern California, in support.
Erin DePay with Planned Parenthood Affiliates of California, also in support.
Very good. So why don't we now hear from any witnesses in opposition? Senator Wiggins is chuckling because she recognized a constituent.
Yeah. Maureen Evans' daughter.
I know.
Jason Gappert with the Association of California Life and Health Insurance Companies. As we've testified before, our association has taken an oppose on all the mandates. There's currently 6 still moving in the legislature right now, and I think there's a total of about $130 million in costs. Specifically for this bill, CHBRP estimated that there'd be $84,000 increase in employer premiums and $1.3 million in individual premiums. And we just feel that mandates reduce our flexibility to offer more affordable products that best suit the needs of the employers and the individuals that we sell our products to.
Marty Fisher, California Chamber of Commerce. We're also in opposition. We're concerned that while this specific health benefit mandate may increase costs only minimally, that overall in the big picture it will increase premiums, and employers will have less opportunities, less flexibility, and less money to go towards covering their employees. So we're concerned about the increase in premiums. Thank you.
Thank you.
Thank you, Mr. Chair. Members, Nick Luizos, California Association of Health Plans, in opposition.
Okay. Any other questions from members of the committee? Ms. Strickland.
Senator, I'm concerned at this time that there remains only one drug manufacturer on the market that treats HPV. Is that the case, that there still is only one?
If I may answer,
manufacturer?
first of all, that's not atypical for a relatively new vaccine to have somebody be out front. But there is a new, another vaccine, Cervarix, that is expected to be approved by the FDA within the year.
Aside from the issue of mandates, which I think we've spoken of ad nauseum in this committee, and the costs to individuals who have to pay for their own coverage, as well as the cost to the health plans, and then what that does to our premiums, obviously, I have very serious concerns about the current treatment for HPV, the fact that there is only one drug maker, the fact that there are some very serious interactions that can occur, the fact that the drug that is on the market hasn't been tested at length. We do not know whether or not a booster is needed. We do not know how long the drug is actually effective for. We do not know the efficacy of the drug if only 2 of the 3 shots are taken or 1 of the 3 shots. I think there's an awful lot that remains yet to be seen about how we can go about most effectively addressing cervical cancer, genital warts, addressing HPV. And so at this time, I cannot support this, although obviously as a woman and as a mother of a daughter, I'm very concerned about this issue. I just don't believe at this time this is the answer, given this economy and given the medical information that we have about how to treat this at the moment. Thank you.
Mr. Emerson.
Yes, I have a question. That CHBRP estimations are that over 99% of all privately insured females are covered, and that this would cover 11 to 26. Well, is not this vaccine not effective for someone over the age of 26?
Currently, the medical guidelines are up to age 26. Part of the efficacy of the vaccine is that it needs to be given prior to exposure. And generally, women over 26 are going to be more sexually active and have had more chance to be infected. So now it is limited to women 26 and under.
Thank you. Other questions? Seeing none, would you like to close?
Yes, I ask for an aye vote.
Thank you very much. We have a motion. We have a second. If there's no further discussion from the committee, the motion is due pass as amended to appropriations. We thank you for taking the amendment suggested in the committee analysis.
Thank you.
Which was something that some of the opponents had raised to clarify what policies and plans this would apply to. With that, we're going to call the roll.
Jones?
Aye.
Jones, aye. Fletcher?
Aye.
Fletcher, aye. Adams? Adams, no. Amiano? Amiano, aye. Block? Block, aye. Carter? Conway? De La Torre? De Leon? Emerson? Emerson, no. Gaines? Gaines, no. Hall? Hall, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Lowenthal, aye. Nava? Perez? Perez, aye. Salas? Salas, aye. Strickland? Strickland, no. That's 10.
That has 10 votes. It's out. Congratulations.
Thank you.
Thank you very much. Senator Cheney has asked if we could take her next, and Senator Pavley has kindly consented. So next we're going to call item number 4, SB 499, with thanks to Senator Pavley. Senator Cheney, welcome.
Thank you very much, Mr. Chairman and members, and thank you to Senator Pavley for her indulgence. This is a simple bill. Appreciate it would report back on something we did last year, transferring funds to Mr. Mibb in support of the high-risk pool. There has not been any opposition that we're aware of, and we think it's important for legislative oversight and accountability of these funds. Ask for your aye vote.
Do you have any witnesses?
Teresa Stark with the California Medical Association in support.
Okay. Any others in support? Is there any opposition to the measure? Would you like to any questions from members of the committee? Would you like to close? Would you like to close, Senator?
No, thank you very much, Mr. Chairman. Ask for your aye vote.
Okay, we have a motion for Mr. Emerson, a second for Mr. Fletcher. The motion is due pass to appropriations. Let's call the roll.
Jones?
Aye.
Jones, aye. Fletcher?
Aye.
Fletcher, aye. Adams? Adams, aye. Amiano? Amiano, aye. Block? Block, aye. Carter? Conway? De La Torre? De Leon? Emerson? Emerson, aye. Gaines? Gaines, aye. Hall? Hall, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Nava? Perez? Perez, aye. Salas? Salas, aye. Strickland? Strickland, aye.
Thank you very much, members.
13 votes. It's out. Congratulations, Senator. Thank you. Next, we're going to call item number 3, SB 257. Welcome, Senator Pavley.
Yes, somehow when the budget chair says she needs to get in front of you in line, you say, of course. Of course, I had to lobby on a few issues while she was standing next to me. But anyway, thank you very much. Pleasure for me to be here. First time back in the Assembly in a few years, so I remember this place.
We're delighted to see you.
This bill, Senate Bill 257, builds on AB 1025, which was the Workplace Lactation Accommodation Bill. This passed back in 2001 when I was in the Assembly, and it was authored by Assemblymember Dario Fromer. When the bill was signed into law, the Department of Personnel Administration sent a memo to all the state departments informing them of the new law. But then it was the responsibility of each of the human resources departments within each state department and agency to notify their employees. Because this original bill did not include any specific language on the notification of the law to employees, a patchwork sort of quilt of accommodations and lack of notification to employees, that's women particularly getting ready to leave on maternity leave, they didn't know about their lactation rights. WIC, the Women's Infants and Children's Association, is the sponsor of this bill, and they have found out that because AB 1025 is a relatively new law, and there was no notification language to women before they went on maternity leave, many mothers continued to be uninformed, which in the long run has health implications to the children as well as the mothers. Senate Bill 257 approaches the problem in an educational and, I emphasize, low-cost manner that will impose absolutely no new cost to the state. Specifically, this bill would require every state agency and department, this is only state agencies and department, not the private sector, when notified by a female employee that she is nearing maternity leave, to notify the employee through its usual channels of communication in a cost-effective manner. This could be through websites or existing brochures. This isn't new requirements. It's just sort of trying to have a notification process that's consistent throughout all the state departments and agencies. Health benefits to children are well documented. Today I have with me two witnesses, Elizabeth Furry, who works for the Sacramento County WIC program, and Roberta Gonzalez Dow, policy advocate for the California WIC Association.
Wonderful. Welcome. There's a motion for Mr. Emerson, a second for Mr. Nava. So why don't we hear from the witnesses?
Okay. Thank you, Chairman Jones and members of the committee. I am Roberta Gonzalez Dow, registered dietitian and certified lactation educator with the California WIC Association, sponsor of SB 257. The California WIC Association is a nonprofit organization representing all parties interested in the operation of the Special Supplemental Nutrition Program, Women, Infants, and Children, known as the WIC program. One of our primary efforts is to remove barriers to breastfeeding for women in California. I just want to provide you with some highlights of the research that support this bill. Research studies have shown that breastfeeding has protective effects against the development of respiratory illness, bacterial and viral infections, allergies, obesity, and a number of chronic diseases, including juvenile diabetes. Breastfeeding also reduces the mother's risk for developing type 2 diabetes and breast and ovarian cancers. These health benefits translate into significant cost savings to business and a return on investment for accommodating women with a private space and time to pump her milk in the workplace and then informing her about these accommodations. Research shows that breastfeeding employees miss work less often to care for a sick child. One-day absences to care for sick children occur more than twice as often for mothers of formula-feeding infants than mothers of breastfeeding infants. Breastfeeding has been found to lower health care costs. For example, the company Cigna conducted a 2-year study of nearly 350 employees using lactation support and found the program resulted in an annual savings of $240,000 in health care expenses and 62% fewer prescriptions. There is also less employee turnover when breastfeeding women are supported in the workplace. According to the U.S. Department of Health and Human Services, companies of all types found that lactation programs can have a positive impact on their bottom line, including lower turnover, additional health care savings, higher productivity and loyalty, and positive public relations. Studies have also shown that employees are more likely to return to work when their workplace provides a supportive environment for continued breastfeeding. SB 257 is needed to ensure that state employees are aware of lactation accommodations in the workplace. In a recent conversation I had with a woman that returned to work in April, she knew about the lactation accommodation in the workplace, but nobody told her of the process to use the room. And she didn't realize that she had to have badge access. So for a whole week, she had to run around finding other women's badges that had access to the room to use the room. And this caused her to not be able to focus on work just because of the pain of knowing that she needed to pump and her breasts were filling up. And this was critical for her because this was how she provided the nutrition to her baby because her baby never latched on. So she was 100% pumping. I urge your support for this vote, and I ask for your aye vote. Thank you.
Thank you. I just want to note that we have a motion and a second, and it represents support on both sides of the aisle and a very favorably inclined committee, I think, to support this measure. So if you could be succinct, that would be great.
That's a good suggestion.
My name is Elizabeth Feehill, and I just wanted to express my the positive impacts that this bill would have on many of the employees in the WIC program, as well as any states. When I first returned to work, I wasn't notified of the law, and luckily I was outspoken enough to ask about it, but I know a lot of mothers aren't as outspoken as I am, and I really encourage that mothers know of these services.
Thank you very much.
Mr. Chair and members, I'm Terry Calgar-Hill with the California WIC Association, sponsors of the bill.
Thank you.
Shannon Smith-Crowley, ACOG in support.
Thank you very much. Any other witnesses in support? Any witnesses in opposition? Any questions from members of the committee? Ms. Strickland.
Well, I think I shared with everyone my opinions about nursing last week on the floor. But obviously, if the state has made the accommodation to create opportunities for women to continue to take care of their children in this fashion, then it seems appropriate to inform them about them. And it seems like you're doing this in a fiscally responsible way. You can be notified by email or whatever. And we've, everyone already knows about the benefits of nursing, and it sounds like. And I don't have a problem putting mandates on the state. The problem comes when we put them on employers and on public sector and on cities and counties when they have to carry out things for us. And so the fact that I believe that there is in a cost-benefit analysis that it would benefit the state in order for this to be in place, because you would have healthy mothers and healthy babies and more people at work when they need to be, and ways to accommodate that. So I'm proud to be in support of your bill today, Senator.
Thank you very much, Assemblymember Strickland.
Very good. Any other discussion, comments, questions, jokes from the far right of the dais? Someone arrest that man. Okay, good. We have a motion. We have a second. Would you like to close, Senator?
Ask for your aye vote.
All right, let's call the roll. Oh, the motion again is due pass to appropriations.
Jones?
Aye.
Jones, aye. Fletcher?
Aye.
Fletcher, aye. Adams? Amiano? Oh, no. Amiano, aye. Block? Block, aye. Carter? Conway? Conway, aye. De La Torre? De La Torre, aye. De Leon? Emerson? Emerson, aye. Gaines? Gaines, no. Hall? Hall, aye. Hayashi? Hayashi, aye. Hernandez? Hernandez, aye. Lowenthal? Nava? Nava, aye. Perez? Perez, aye. Salas? Salas, aye. Strickland? Strickland, aye.
That bill has 14 votes. Congratulations, and thank you for bringing such an important bill forward to the committee.
Thank you, Mr. Jones.
Thank the witnesses as well. Thank you very much. So we have two consent calendar items. They were previously announced. The chair is looking for a motion on the consent calendar. Motion for Mr. Emerson, a second for Mr. Nava. Let's call the roll on the consent calendar.
Jones?
Aye.
Jones, aye. Fletcher?
Aye.
Fletcher, aye. Adams? Adams, aye. Amiano? Aye. Amiano, aye. Block? Block, aye. Carter? Conway? Conway, aye. De La Torre? De La Torre, aye. De Leon? Emerson? Emerson, aye. Gaines? Gaines, aye. Hall? Hall, aye. Hayashi? Hayashi, aye. Hernandez?
It's a consent calendar.
Hernandez, aye. Lowenthal? Nava? Nava, aye. Perez? Perez, aye. Salas? Salas, aye. Strickland? Strickland, aye. De Leon, on the consent calendar. De Leon, aye.
Ms. Lowenthal.
Lowenthal? Lowenthal, aye. That's 18.
Okay, that is 18 votes. Members, that concludes the business of the committee today. I just want to remind members we will not be meeting next Tuesday. I want to thank the members for coming on time, and note that when we're on time, we get done a lot faster. Thanks again. With that, we're adjourned.